Welcome to a new edition of our Wellness Talks. I had some very serious health issues, but when I learned a very good key concept about healing from none other than Dr. Bruce Lipton, the world-renowned biologist, it literally changed my life. The next 7 minutes will surely help you to understand the healing concept to revolutionize your health and well-being. The placebo and the nocebo effects are psychobiological events capable of being assigned to the therapeutic context. Placebo is defined as an inert substance that produces perceived benefits, whereas the term nocebo is used when an inert substance causes perceived harm. Placebo is used in several fields of medicine as a diagnostic tool or to reduce drug dosage. Placebo and nocebo effects are difficult to disentangle from the natural course of illness or the actual effects of a new drug in a clinical trial. There are known strategies to enhance clinical results by manipulating expectations and conditioning. Placebo and nocebo effects occur frequently and are clinically significant but are under-recognized in clinical practice. Physicians should be able to recognize the phenomenon and master tactics on how to manage their effects to enhance the quality of clinical practice. The placebo effect is one of the clearest demonstration on how thinking affects the body. Believing that someone has given you an effective cure for a problem, although they must have just given you a sugar pill or waved something over your head, can not only cause emotional calming but actually change the physical experience within the body. In a more common example of how thinking influences the body, have you had this experience? You went to bed late one night during the work week, looked at the clock, calculated the hours you had to get up and thought to yourself, I am going to be exhausted tomorrow. In the morning, you felt miserable as you climbed out of the bed and dragged yourself to work. All day long, you reinforce this feeling by repeating, am I tired? Sounds familiar? Now replay the same scene, but this time it happens when you are on a vacation. You stay out late into the night, dancing, partying. Going to bed, you anticipate the exciting prospects of the next day, new adventures, new sights, and new people. Remember that some of the people thrive off only a few hours of sleep a night, and armed with this thought, you retire happily. The next day, you leap out of the bed ready for the magic, barely giving a moment's reflection to the amount of sleep you have had. Your thoughts have energized your body. The term nocebo comes from the Latin to harm. The nocebo effect is in fact an expectation about negative treatment. Almost a polar opposite to the better known placebo effect, it works through our negative assumptions and conditioning. For example, there is a high risk that a cancer patient who has always experienced nausea after chemotherapy will expect the adverse side effects, and an anticipatory anxiety will then produce the negative expectancy. In medicine, the nocebo effect can be as powerful as the placebo effect, a fact that you should keep in mind every time you step into a doctor's chamber. By their words and their demeanor, physicians can convey hope-deflating message that can be avoided. An example is the power of the statement, you have only 6 months to live. We are aware of the nocebo suggests that physicians, parents, teachers and media widely use to program us to believe that we are powerless. I suppose we are now getting our daily doses of nocebo ever since the beginning of this pandemic. Fear is a great way to control people. The nocebo phenomenon is so evident now when we watch the mainstream media, read newspapers and follow the relevant posts on the social media. Our positive and negative beliefs not only impact our health but also every aspect of our life. Our beliefs act like filters on a camera, changing how we see the world, and our biology adapts to those beliefs. When we truly recognize that our beliefs are that powerful, we hold the key to freedom. While we cannot readily change the codes of our genetic blueprints, we can change our minds. Many strange and extreme medical events have been attributed to the nocebo effect, including deaths. One reported case from the 1970s describes a cancer patient who died after being told that he had 3 months to live, only for it to be discovered at autopsy that the stage of his cancer had been misdiagnosed and could not have been the cause of death. The nocebo effect may also be responsible for the phenomenon of mass psychogenic illness, where symptoms with no apparent cause rapidly spread through communities. The phenomenon could explain adverse reactions to Wi-Fi or wind turbines, which have been blamed for headaches, dizziness and fatigue. Nocebo effect is possibly more powerful than the common flu virus, in that it compromises your immune system before you have even had a chance to catch the actual virus. And that is why you should avoid the nocebo effects of the pandemic at all costs. You must have heard from many doctors and wellness experts that if you do not believe in a treatment, regardless of good treatment, it will not work on you. Your recovery gets impacted because that is the message you are sending to your brain. Unfortunately, the nocebo effect has a huge impact, as the negative expectations tend to be formed much faster than positive expectations. And this has an evolutionary reason, because our bodies are programmed to protect us from adverse events. A crucial question for the physicians is whether a nocebo response, once produced, can be reversed. The good news is that the answer seems to be yes. The nocebo effect could even be changed to a placebo response. Only giving the medication is not enough anymore, because we know that the power of the brain may be modulating side effects. The right kinds of communication with patients have the potential to positively shape patient expectations and reduce side effects. So, be the placebo and not the nocebo. Use the current situation of pandemic to go viral with the idea that communities can support each other and work together to eliminate threat against the humanity, not just the actual virus, but all nocebo-like thought forms. Stay tuned to this channel for more interesting wellness talks. See you soon. Till then, stay blessed and God bless you.